Now we're into a segment that we've come to really enjoy. We call it What's Up, Doc, where we spend some time with the fine professionals with Mercy Health. And this morning is no exception. Our guest this morning is Dr. Patricia Moody, who's a pediatrician with Mercy Health. Dr. Moody, good morning.
Good morning.
How are you this morning?
I'm very good. How are you guys?
We have nothing really to complain about.
Right.
I'm over looking on the webpage a little bit about you. I saw additional areas of special interest include adolescence, so I figured you'd be perfect to deal with us.
Oh, there you go.
Should be no problem at all. Talk a little viral illness in winter months. What are the common things that we're seeing throughout winter? It's not just a cold. It's not just the flu, and we've got that other nasty thing that is creeping around us too.
Yeah, I mean, that's what we usually do see is more colds and flu and RSV, which can, it's similar to a cold, but can affect smaller children. We see it more. It's around all the time, but we see it more because we're inside more and we're able to pick up stuff.
I remember, when my kids were small and were doing some daycare and all that, it seemed like it was the disease of the week. What are we coming home with this week? Oh, well, it's pink eye this week. Okay, we picked up a nasty cold here. We picked up a cough here. And I remember my parents going, where are you sending your kids that this is happening? I was not a daycare student myself, so they didn't have to deal with that. But it has seemed to me that as a kid, when they got all that out of the way, it's paved the way for a lot healthier adolescence and into adulthood.
Right. I think when we grew up, we started in school, and now because kids are in preschool and daycare, they do pick up these things sooner in their growth, and they do get a better immunity as they get older. However, colds, it's not a lasting immunity, so we're all susceptible to colds and flu.
Before we get to talking about more kids stuff here, we always like to talk to our guests on this segment about a background, where you did your schooling. How did you get to the path to a pediatrician?
Sure. I grew up on the East Coast in a town called Hingham in Massachusetts. Did my schooling out there and medical school in St. George's, which is in the Caribbean, which is a lovely place to do
very
school.
Yeah.
And I trained in New York City, and I made my way out here to Rockford and been out here for 20-plus years.
When did you know pediatrician was what you wanted to be?
Yeah, I thought I wanted to be a surgeon, but then once I got into my clinicals and dealing with kids, and they're so resilient, and it's a wonderful thing every day to come in here. And what they say, it was just my calling.
I'd say, yeah, you knew, it just dawned on you that this is what I'm supposed to be doing.
Yep.
That's outstanding. A little bit more about what goes on as far as the colder months and all that. Is it wrong to think that perhaps we might see a reduction in colds and flu and some of these other things in kids simply because of the distancing and the lockdowns we're dealing with?
Yeah, I definitely. We're learning a lot with wearing masks and social distancing and, flattening the curve. We're not flattening too well right now, but it's definitely flattened the curve on other viruses. So I think these kids growing up with wearing masks and learning how to, cough in their elbow and sanitizing, they're definitely going to be less susceptible to picking up things.
Do you think that will continue on, in the next couple of years?
I think so. I think it's definitely teaching us all a lot about viruses and how to prevent and to keep yourself healthy.
What do you say to people? Because I would imagine with COVID-19 being in the state that it's in right now, and I don't mean physical state, but I just mean everywhere. But when someone comes down with a case of the sniffles, I've got a little bit of a sore throat. Our minds instantly run to COVID-19. Is there anything that you can say to people who are, looking at a symptom or two before going, I think we're in real trouble here, to take a minute and think about what you may not have?
Yeah, I mean, it most likely is a cold. The thing is, flu, cold, and COVID all have symptoms that are very similar. And so for us as physicians, it's really hard to say, yes, this is a cold and it's not COVID. So unfortunately, a lot of these kids have to be tested just to make sure, so we're not spreading it to other facilities like daycares and schools.
As a pediatrician, a lot of schools around here, I'm sure, as you know, have flipped back to 100% remote learning. I'm sure, everybody wants the kids back in school, and you understand maybe can't do that right now. What kind of kind of care do parents need to look out for kids? You know, we've heard depression kind of setting in. How much concern should parents have for kids being isolated right now?
Yeah, I think not having that socialization is a huge problem, and we are seeing a uptick in depression, and most of it's situational. But yeah, if they're in their room more, if they seem down, crying for no reason, just a lot of gloom and doom in their personality, then definitely they need to reach out to the child first, and also the schools have lots of services, and definitely to the pediatrician if there's concern.
Yeah, how much of the mental aspect is involved with pediatricians? I know you physically, I mean, you take care of them, but is the mental aspect something that you guys take care of?
Yes, definitely. So we most of us all have certain slots in our schedule and for depression and anxiety, and we're seeing those fill up.
I was going to say, are you seeing an uptick in this, or are these are scattered cases? And we often hear about how resilient kids are, that maybe they are handling it better than we think.
In the beginning, we were definitely seeing an uptick, but it's starting to settle down. People are getting into the routine, but it's still an issue.
How important is the flu vaccine as far as kids go?
It is so important. It does help prevent. It's one of the only things that is going to help prevent, besides social distancing and hand washing. It definitely works. People shouldn't be afraid of it, and bring your kids in and get it done.
What's the biggest misconception about child health that you correct most often?
That colds are treatable. Viruses need antibiotics. I think that's a hard one to get across. It's just symptomatic care, and not everything needs an antibiotic thrown on.
Are parents today better educated when they come in with their kids, or is the Googling and going to WebMD and all that counterproductive?
It's hit or miss. Sometimes they'll come in with something that you didn't think about. But for the most part, we try to keep parents off Google. But they're definitely better educated. But it can also play that part of thinking something horribly is wrong with your child when there really is. It's very common, whatever's going on.
Yeah, what is it about going online to look up something? You've got a symptom, you read something, you click on it, and the first results that you get hit with is, oh, well, you're a dead man walking.
Yep, right. I don't know. I do it myself, and I do it for my kids myself. So, yeah, I think it's just human nature wanting to know.
Speaking of parents maybe Googling too much, people that are not for vaccinating their children, I'm sure you get some of that going through your office. First of all, I'm sure you're pro vaccinations for children.
Yes.
Okay. All right. Well, what's the discussion like when you have a parent come in that does not want to get their kid vaccinated for the common diseases?
It's education. And I always say that we vaccinate to help children, not to harm them. Vaccines have been around forever, and it's really important. So we try to educate, and some we can convince that it's a good thing, and it might not be the schedule we're using, but at least we're getting some on board. Some are on their own schedule. They'll bring in a schedule, which we don't try to advocate that, because we do a schedule for a certain reason. But some just refuse, and that's an issue, because they're putting us and all the children that are being seen that day at risk. So.
And then a follow-up on the vaccine question. We maybe be having a COVID-19 vaccine coming our way. Have pediatricians talked about the safe for children, the efficacy on children? What's the deal with your kids getting that vaccine?
Yeah, I think that's going to be a while. So, it's still out there, and until this one comes through, and there's other problems with refrigeration and being able to store these vaccines. So I think we've got a little bit of a way before the vaccine comes through.
I would imagine it's an interesting tightrope walk being a pediatrician, because when you're just dealing with adult patients, it's basically your rapport with that patient, and when you're a pediatrician, it's your rapport with the patient and, of course, the parents of the patient who are sitting right there as well.
Yeah, I mean that's part of the problem. As far as not only are you dealing with the child, you're dealing with the parent, and it's educating. I mean, we do a lot of education, just newborn babies, new moms, talking them about viruses and not antibiotics, the plan and whatnot. So, yeah, it's seeing two people, not just one.
I can remember, with our kids' pediatrician, we got so lucky. We just had the finest pediatrician. I always look forward to their appointments because I wanted to go along because I enjoyed being in there with the doctor.
Yeah, it's fun.
It is, and when with someone who strikes that right rapport, I mean, the communication between doctor and my kids was outstanding. But then turned right around and put the adult hat on to deal with my wife and I, even equally strongly. That's a wonderful combination.
Yeah, and I try to thrive to just discuss things with kids, even as young as 3, and direct my attention to them, and look at the parent when I need some more direction or an answer. So it's so much fun engaging with the kids. What comes out of their mouth is hysterical. I wish I could write a book. It's a wonderful profession. I love it.
Before we let you go here, and I'm sorry, one more, maybe more serious question for you. This may have changed in COVID, but what's the treat situation in your office? Just the safety suckers, or do you have something special going on?
Yeah, that's a very serious question.
Thank you.
It's a sucker and a sticker, and of course I have to go get them now because of COVID. They can't pick out anymore, but yeah, that's the final. And I wish I could get so happy over a lollipop and a sticker.
How often do you sneak into this sucker stash without kids looking?
Every once in a while.
All right.
The green are my favorite.
Ooh.
And then the other one, because this is a common practice when my kids were young, and they still try to pull it as adults. Whenever there was a vaccination, a shot of any sort involved, that automatically meant we got ice cream afterwards. As a pediatrician, was this a good, solid approach to parenting?
Definitely. Bribery always works.
And one more sucker question. What percentage of parents also ask for a sucker before they leave?
Oh, good one.
I'd say about a quarter of them.
Oh, all right.
Yeah.
So don't be embarrassed.
Yeah.
No, don't be embarrassed. And I usually know those ones and know what color they want.
It's that recall that a doctor has. Dr. Moody, thanks a lot for taking time out of your day for us. For people who want to make contact with you, would love to make an appointment. They're listening this morning going, you sound like the perfect candidate to be my child's pediatrician. How do they do it?
They just have to call 971-2000. That's a doctor line, and they can get connected to our office.
Outstanding. Dr. Moody, again, thank you so much for your time. You were a delight. We really appreciate it. Enjoy the rest of your day.
You too. Thank you.
Dr. Patricia Moody with Mercy Health.